Welcome. I am Jason Downer. I'm a professor here at the School of Education and Human Development, and really pleased to welcome alumni, friends, families today to our webinar, Supporting Our Youngest Generation, Challenges and Opportunities in Early Education and Childcare with Dean Pianta. This event is a collaboration between UVA's Office of Engagement and the School of Education and Human Development. And I just want to let you know before we begin, we are recording this event. If you have questions along the way, you can submit them to the panelists by using the Q&A function, which should be towards the bottom of your screen. We'll try to get to as many of those as we can towards the end of the hour. So at this time, I'd like to invite Dean Pianta to join us. Dr. Pianta is the Dean of UVA School of Education and Human Development, also the Batten Bicentennial Professor of Early Childhood Education, Professor of Psychology, and the founding director of the Center for Advanced Study of Teaching and Learning. He's an internationally recognized expert in early childhood education and K-12 teaching and learning, perfect person to moderate today. So welcome, Bob.
Thanks very much, Jason. It's a great pleasure to be here. And I, again, want to reiterate your welcome to everyone who's joined the conversation today and the discussion. Before I introduce and invite my colleagues to join me on the panel, I just want to share a couple of contemporary realities I think can frame our conversation today. So if we think about children from birth to 5, those years before kids formally enter school, we now know that it is very much the case that children the vast majority of kids in that age span spend time in childcare or a preschool program, daycare, Head Start, public preschool. It is the norm in the United States. 75 to 80% of kids at some point in time will spend time in one of those programs. And the evidence is quite strong that the experiences that children have in those programs can be beneficial to their learning and cognitive development, their adjustment, and even their health. The effects of those programs and the time that kids spend in those programs can vary across studies and can vary across program types and the quality of programs. But in the main, early care and education is an asset for children, families, and our society. This is why President Biden went as far as considering early care and education an aspect of infrastructure and played such a prominent role in his Building Back Better proposal, which included, as you may know, funds for universal pre-K for 3 to 4-year-olds and increased compensation for professionals who work with young children. However, there are a couple of other realities that also frame what we're going to be talking about today. And let me just jump into a couple of those, and then we'll do some introductions. So the adults who spend time with kids are really important to them. And yet, as of January's job report, the childcare sector remains 12% below its pre-pandemic staffing levels, with a loss of well over 100,000 jobs. And the pace of regaining those jobs relative to other sectors has been very slow. In the last 2 to 3 months prior to January 2022, only 13,000 of those childcare jobs were added back to the economy. In pre-K and Head Start, these are more publicly sponsored programs and publicly funded programs. We've lost trained and credentialed teachers at an alarming rate. And we see levels of stress and burnout that are quite high, largely tied to these teachers, educators' dual roles as both educators and parents of young kids themselves at home during the pandemic. 500,000 certified teachers left the profession last year. That's K-12, with more on tap this year. And that number is actually just about what teacher education programs produce in new teachers nationally. And then on financing, the federal government puts approximately $22 billion annually into early care and education, while states combine for 12. As a comparison, the states combine to spend about $640 billion on K-12 education each year. So you can begin to see some of the discrepancies even in public financing. So the question is, with Building Back Better stalled, where are we now? And what can we look to the future for shifts in policy and programs for these youngest kids, and the importance that those programs, that strengthening those programs plays in our society. I'm joined today by three friends and colleagues who I'll ask to unmute themselves and turn their cameras on now, and I'd love to introduce them to you in sequence. So first, we're joined by Dr. Jacqueline Jones. She is the Foundation for Child Development's president and CEO. Before her tenure at the foundation, Dr. Jones served as a senior advisor on early learning to Secretary of Education Arne Duncan, and as the country's first Deputy Assistant Secretary for Policy and Early Learning in the U.S. Department of Education. She also served as Assistant Commissioner for the Division of Early Childhood Education in the New Jersey State Department of Ed, and as a Senior Research Scientist at the Educational Testing Service for over 15 years. Dr. Jones has been a visiting faculty member at the Harvard Graduate School of Education and a full-time faculty member at City University of New York, received her master's and PhD degrees from Northwestern. Welcome, Jackie. Dr. Sam Meisels is the founding executive director of the Buffett Early Childhood Institute at the University of Nebraska. A former preschool, kindergarten, and first grade teacher, he was a senior advisor in early childhood development for the Developmental Evaluation Clinic of Boston's Children's Hospital. Before that, he was a professor in the Department of Child Study at Tufts and director of the Elliott Pearson Children's School. For 21 years, Dr. Meisels was a faculty member at the University of Michigan School of Education and a research scientist at the Center for Human Growth and Development, where he is, this intro, Sam, has you as still professor there. Are you still professor at Michigan? No.
I'm Professor Emeritus.
Emeritus, sorry. He graduated magna cum laude from the University of Rochester and received master's and doctoral degrees from the Harvard Graduate School of Education. Sam holds an honorary doctor of humane letters from Roosevelt University in Chicago. And finally, Dr. Amanda Williford is currently the Batten Bicentennial Professor of Early Childhood Education and Associate Director for Early Education at the Center for Advanced Study of Teaching and Learning here at UVA. She holds a PhD and MA in clinical psychology from the University of North Carolina, Greensboro, and a BA in psychology from the University of Virginia. Her current research is focused on developing and evaluating classroom-based interventions for young children who display disruptive problem behaviors and/or deficits in behavioral and emotional self-regulation. Dr. Williford also mentors PhD students in our clinical and school psychology program here at the school and in educational psychology, applied developmental science. She has strong interest in conducting applied research in areas aligned with this broader initiative around early childhood education. So welcome, everyone. I asked each of you to kind of lead us off with what you see as the single greatest opportunity and the single greatest challenge facing early education now and for maybe the next 5 to 10 years. So why don't we start there? And Jacqueline, why don't I ask you to lead us off?
Sure. Bob, thanks so much for the opportunity to talk with everyone today. The Foundation for Child Development funds research that can influence policies and practices to enhance the well-being of young children, their families, and the adults who work with them. For almost 8 years, we've supported efforts to improve the compensation, preparation, and ongoing professional development of the early childhood workforce. So I approach your question from that perspective and with 2 challenges and opportunities in mind. First, the pandemic has revealed how essential childcare is to the overall economy. And with that focus comes an opportunity to fully detail the complex nature of the work of early childhood professionals and support them before we lose this workforce because they can't feed their families on the low wages they receive. I think the challenge is to chip away at that stubborn belief that anyone can take care of children. With over 40% of the workforce reported to be women of color, we also have an undervalued profession that sits at the intersection of gender and race. I think a very strategic narrative change is needed. Second, I think the country's focus on equity and racial justice and part 2 of the Tennessee preschool study, pardon me, I see this as an opportunity to better understand and design the design and impact of early childhood programs. This is a research opportunity. The challenge is figuring out how we reframe our research approaches to go beyond the question of does it work, whatever the it is, to what are essential elements of the programs we're studying, which of these elements have positive impacts for the children in that study and which do not, so that policymakers and practitioners can actually make programmatic adjustments that lead to continuous quality improvement. And finally, from an equity and social justice perspective, we should challenge the mental model of compensatory interventions for children who we've described for so long as deficient and deprived across cultural, linguistic, and economic domains. I think we should build and acknowledge we should build acknowledgement of and respect for the assets and the strengths that children, their families, and communities bring to the work of nurturing the potential of every child. So I think my 2 minutes is up. That's what I've been thinking about.
Thanks, Jacqueline. Amanda.
Thanks, Bob, and thanks, Jacqueline, for all those really critical points. I think, at this moment, we're sitting in a space where we have great support and acknowledgement of the importance of early childhood education and care. It is one of the very, very few issues right now where we have support across political parties. And almost everyone agrees that families need more support to ensure that their youngest citizens have access to quality education and care. And, there's like unanimous understanding right now that children are our future and that their early development kind of is critical for their own lifelong learning and our future workforce. And I think with that kind of unanimous understanding and support behind early childhood education and care comes with the opportunity that we could really recognize the full arc of early childhood education and care and really think of it as birth through third grade. With that opportunity, though, does come kind of these challenges. So I think one of the greatest challenges is that even right now in our conversations, we have a set of like false dichotomies and fallacies that are kind of changing our conversation and driving divisions in what early childhood education and care mean that kind of threaten to reduce our thinking in early childhood education and care in ways that causes divisions between researchers, advocates, practitioners, and policymakers that really don't need to exist and won't kind of advance the cause. And so I think about the fallacies of childcare versus preschool, childcare versus caring for your child at home, play versus learning, teacher-directed versus child-directed, academic versus social emotional learning, childcare worker versus teacher, when really we are talking about care and education, that learning occurs in the classroom and at home, that children learn while they're playing, that children learn academic skills and social emotional skills at the same time, and that teachers provide structure and children need autonomy and choice, and that educating and stimulating the minds and bodies of a 3-month-old, a 3-year-old, and a 3rd grader are equally important.
Thanks, Amanda. The terrific reminder of all of the both ands. That was great. Sam, how about you? Opportunities, challenges.
Thank you, Bob, and thank you for inviting me to join this and to join my 2 colleagues, Jacqueline and Amanda. I came to Nebraska 8.5, 9 years ago for the opportunity and for the challenge. And I had in mind 2 areas in particular after a fairly long time of being in this field, a very long time. And one had to do with closing the opportunity gap, and the other had to do with enhancing and elevating the early childhood workforce. So to think about what the challenges are, or think about what the opportunities are, is also to think about the challenges. These are those 2 areas of closing what we normally have in the past called achievement gap, and closing and elevating, going the other direction, let's say, the early childhood workforce are vastly difficult. And I came here because here was an opportunity, in fact, to try to devote myself in the last decade of my work career to doing precisely those things. And I can tell you, they remain challenges, and we haven't solved it. The issues of equity became highlighted, pronounced, and painfully placed in front of us over the last several years. We've become more aware of it. People talk about a racial reckoning. I see it as very far from a reckoning. I see it as too similar to everything else that we have seen over the years. And we see this in our early childhood programming. We see this all the way through K-12. Our work here happens to be from birth through third grade, and the needs are vast in all of those. But also, when you think about the workforce, then this is something that I think has gotten attention that has not been provided to it previously. Both Bob and Jacqueline mentioned some specifics about it. We've done 3 surveys during COVID here in the state of Nebraska. One survey we did of practitioners and also of directors of programs. The first survey we did was in March of 2020. So basically a month after COVID began to close things down. The second survey was done a year later. The third was done like yesterday. I mean, yesterday I got the first high-level data from it. And just to give you quickly a couple of this is 750 respondents, practitioners in early childhood programs. Children were all younger than age 5. Over half of the providers have had COVID themselves at least once. And further, almost half of those providers have contracted long COVID. So this has been a tremendous problem for them. Providers continue to be worried about families sending children to programs, even though those children may be sick, because the parents can't afford not to go to work. Providers are experiencing ongoing impact to their businesses. 2/3 of providers have experienced further income reductions from last year, and the year before it was even worse. More than 4 in 5 providers are having difficulty hiring staff. 2/3 of providers with staff members have experienced staff leaving, and on and on and on. So the opportunities are there. The challenges are vast. None of us is going to walk away from those things, but we need you to help us to make a difference in them.
Thanks, Sam. Let's pick up on that thread of workforce a little bit. Sam, those statistics are stark and dramatic. And I mentioned the legions of folks leaving. Jacqueline, this is something that the foundation leans in on pretty heavily, as you noted. Given the fact that we're looking at a workforce that's under tremendous stress, psychologically and in terms of health, in terms of their family, and economically, and I think the importance of the points you raised around equity, so that in fact, in any effort to address workforce issues, equity and representation of women in color and the compensation that should travel with that are critically important. What sort of solutions are on or kind of promising innovations, state level, local level, that you've seen, Jacqueline? Then we can, if Amanda and Sam can kind of jump in on that one.
So I'll start with a group of funders who have all been looking at the workforce in early childhood and decided, I guess, maybe about 5 years ago, that together we might be able to make an impact. But as Sam had said, this is an enormous issue. So to start with preparation, I mean, we can say every teacher should have a BA, but inherent in that is the assumption that all BAs are created equal, and we know they're not. So how do we support higher education to get at least a pipeline of not just folks who can engage in this work and do it well, but a pipeline of faculty who are really strong? So we've come together as a collaborative and funded about 10 I think we made 10 grants, maybe a little less, with 8 grants, with $10 million to really try to look at their higher education programs and to work with the state, because just working on their own is not sufficient. They've got to work with the state, look at the competencies that they're asking of folks, and really try to build a strong workforce. On the other hand, it's really hard to get people to say, I will go for this degree when they're not going to, one, be able to afford it. So they're going to be in debt. And two, they're not going to make money enough. They're not going to make sufficient money to be able to pay that debt or to even feed their families sufficiently. So that challenge, I think, is still there. We've seen some work in DC where they've really tried to really pay at parity. I'm always fascinated by the notion of paying at parity with public school teachers, as though public school teachers were making a huge amount of money, but it's better than this notion of minimum wage. So I think from the perspective of philanthropy, there are ways in which I see philanthropic entities coming together in a much more intentional way to look at the big problems. And I think asking the workforce, funding grassroots efforts where folks get some voice and can be able to talk about the issues they face is something that we're really looking at very closely.
Thanks. Sam, any thoughts from your work with workforce?
Well, I think that this is a problem that exceeds what we can do internally, that is within the field. It is something where we need strong allies outside of early care and education to work with us within early care and education. And in fact, families are crucial to our accomplishing this, just as policymakers are, just as people in K-12 are, and so forth. What I'm struck by very often is what sometimes we call cognitive dissonance, where something seems to be quite clear and obvious, and yet our actions do not support those clear ideas. So we know about brain development in the first 3 to 5 years of life. We know about how social development takes place early on in life. We know that if children are not given opportunities to grow and develop early in life, this can have a lifelong impact, just as on the opposite side of that, a strong early experience can have lifelong positive impacts on health, on social interactions, on income, and so forth and so on. So we are facing a tremendous amount of cognitive dissonance in this. And one thing that we've done here is to begin to put together a campaign that will go over a period of several years, where where our audiences will be parents, families, policymakers, schools, administrators, and teachers, where we're trying to make change in their view of the importance and understanding of quality early care and education. Yet in our first studies of this, 500 families in the state of Nebraska, oversampled by race and oversampled by children younger than age 5, we found that everyone thinks, yes, the first years of life are important, but then when you ask them to list that against how important is it compared to controlling the cost of healthcare, how important is it compared to increasing the number of good paying jobs and reducing tax burden, improving quality of K-12 and so forth and so on. Early childhood comes in behind all of that. Mm-hmm. And yet all of us who are on this panel will tell you that the place to start is in the first 5 to 8 years of life. And if you want those other things to happen, that's where you have to go. And yet the evidence is not supporting that people are there yet. So that's a task for us through this public interest, public impact campaign to try to change.
Thanks, Sam. Amanda, anything you're seeing you do a lot of work at the state level, just particularly on workforce, any innovations related to workforce that have popped up?
Yeah, well, our colleague Daphne Basak and the work that she's done, I think some of the really interesting experimental work that she's done that shows just like what a small amount of additional funding does in terms of reducing teacher turnover. And Jacqueline, I was just thinking about what you were saying, like what good is a bachelor's degree if like you like it won't give you any type of earning, like it won't give you a salary that that you can actually live off of. And so the other statistic that we've seen in some of our research is that during the pandemic, we were doing an implementation study and looking at teacher turnover, and 80% of our classrooms had teacher turnover during of really less than a year time. And that could include a teacher that stayed in the system in their program, but had to leave a classroom because they had to cover another classroom. But for a kid, it doesn't matter if you left the program or left their classroom, you've left a child. And so I think one of the things that is interesting in terms of some of the work that's happening in Virginia is really thinking about all types of programs as being part of that system within the Department of Education. So in the Virginia Quality Birth to 5 initiative, really thinking about family day homes and private providers and VPI preschool programs and Head Start and early childhood special education as all under the same umbrella, I think does provide a space where then you have to advocate for equity in that space. So then it's like you said, Jacqueline, like making the earnings of a preschool teacher in the public school is not a lot, but it is very differential from what a family day home provider makes. And so I do think there are aspects of kind of infrastructure that can help us with that advocacy work.
Bob, if I can just
please
comment on Amanda's points. I think the notion of mixed delivery system is something that we really have to deal with. And I've heard people argue, well, why do you want this in schools? Why do you want this someplace else? I mean, I know in New Jersey, we really didn't have a choice when we were doing Abbott preschool. We didn't have space for everybody. We didn't have the capacity. And so a mixed delivery system that for us was school-based programs, private providers, and Head Start, not home-based. And I think that that's another area where we've got to really put some focus. But at least everyone had the same set of standards. And it was really clear what needed to be done. And then you provide the resources to all of those venues to be able to make it work. And I think one of the things we do when we fund early childhood programs is that we assume that if we give folks the money, that's fine. It is a necessary but insufficient piece of this project to make it work. It takes a lot of efforts. When I was the assistant commissioner for early childhood in New Jersey, I had 12 people working from the state who would go into those districts and really try to work. These were people with deep expertise in early childhood education and really try to see what the issues were, come back, we try to brainstorm, provide professional development. But it takes a lot of work, but that mixed delivery system is critical. Children are in a variety of settings and they have to have the same set of standards, the same set of program standards, Amanda, I think is absolutely critical.
Can I add something to that?
Please.
For our audience, you may not be aware that the average salary for a teacher with a BA who is working in early childhood is somewhere in the neighborhood of about $12 an hour, something like that. It varies by state from 11 to 13, something like that. And in some places it's gone up and something like that. But who are our competitors for those people? Who is taking them away? Target is taking them away. McDonald's is taking them away. All kinds of fast food places and box stores are taking them away because they can offer more money. I mean, it's stunning to us who work in this field to actually drive up to a Target store and see a huge banner across it that says $2,500 signing bonus, or even more now than what it was just not so long ago. We don't have signing bonuses in early childhood. What we relied on over the years, over the decades, was the fact that working with children is a magical undertaking. Not that it's magic in and of itself, but for us who do it, it is extraordinary. We are fortunate. However, we too have to eat, and we have to have a place to sleep, and we have to be able to pay our bills. So I guess one could, one of many reasons that our field is primarily female is that those women are supported by husbands, but many of them are not supported that way at all. I can see Jacqueline's about to point that out.
Absolutely. You have women who are leading households, who are doing this work. And I don't even think that supported by husbands is the issue. I think it's, can you do the work? Do you have the competency to do the work? And if you're doing it, you get paid appropriately. I think we have households of people who are taking care of other people's children. They can't take care of their own. And that is just a huge injustice.
It's absolutely an injustice. And another really rather astonishing thing is that we're not talking about a vast amount of money that would change this situation. Here again, not just to use Nebraska, but happens to be something that we've done a lot of intense work on. 0.75% of the gross domestic product of the state of Nebraska would cover all of the needs that we need in this state, not just paying salaries, but also supporting staff, preparing them, and moving forward with important campaigns into the community. So we are simply not paying attention to an area that needs more attention than any other.
Well, I'm going to transition us from this. Oh, Jacqueline, did you just want to pop in?
I was just going to say that I think we need to start thinking in terms of the true cost of quality. And that includes paying folks appropriately with all the supports they need. But it's not just what do teachers get paid? What's the cost of quality programming? I think that's a question that we should be asking.
Well, let's put a pin in that for a minute, because I think one of the things, a real takeaway from this is, workforce is essential. Resources actually matter. We've opened up a lot of programs with public funds. There's a lot of private money that parents are paying, in order to have their child in childcare, and some money flows in as a subsidy. But the collection, I think, Sam, you point this out in very stark terms. The collective resources that wash across that whole system are not sufficient, to retain, as we have all said, a workforce that can capably do the job and be supported to do the job well of caring for kids, despite the fact that, Sam, you pointed out, this is an essential part of a lifespan that has great impact downstream. One other thing I think that I just wanted to point out too, that I think was illustrated in everybody's comments is the state is a critical player in this, in this sector. That there's federal money that flows in, there's private money flows in, but states have a huge role to play. And when states have very intentionally collected those early education and care resources that flow from the federal government, and they provide regulatory controls over the quality of care that kids are getting, we see even more positive benefits that come from the time that kids are spending in these programs, whether they go back to being 6 months old or they go back to 3 and 4 years of age. We see that, Amanda mentioned Daphne Basak's work in Louisiana. We saw that in New Jersey. And I suspect, Sam, you're seeing that in Nebraska and places where, where the Buffett initiative is kind of leaning in, or other places are leaning in around that. So there's a lot of promise here, but there still remains a great deal of responsibility, it seems to me, at the broader public level, but also, how we create pathways or really nudges, maybe even stronger, on states to take full responsibility for this birth to 5, birth to 8 sector. So let's move a little bit to quality, and what happens in classrooms, or what happens in childcare settings for kids. Amanda, you've been working, a lot in this area at the state level. Sam, I suspect you guys have plenty of insights about what families are looking for in terms of quality. And I know, Jacqueline, the foundation has made many investments in this. So Amanda, maybe talk about what you're seeing in terms of the essential elements. What are the levers, when states put their arms around these programs? What are the levers that they can begin to press in on that really do matter for kids and their learning and development?
Yeah, well, as Jacqueline said, I do think we have this acknowledgement that quality early childhood programming comes in all shapes and sizes. And it's not just the state supported preschool programming. It is, whether or not you've decided to keep your child at home and early care and education within your home setting, or a small family day home, or a religious based preschool programming, or private childcare preschool programming, Head Start, early childhood special education, that all sits under what we should expect as a component of, or a choice for quality early childhood education. And within all of those, and I don't want to, go back to an issue that we're not going to solve, but you have to have financial security for the workforce as a base. And the fact that we don't have it means that all of the funding and support that we put into other things at some point kind of really falls short. But knowing that a teacher will stay with you for the year, whoever it is that is providing the education and care for your young child will be able to stay with you for a full year, is critical. And you want that. And so we want to be able to kind of maintain a workforce over time. And what does that mean? And then you want them to love their job. And they can't love their job if they're not well prepared. So if they don't have the training and to know the developmental knowledge and how that translates into practice. So are they proficient in doing the things in the classroom that will make them and the children and their care and education kind of thrive? So you have to be able to be well prepared, and then you have to be continually well supported. So you can't, we wouldn't expect someone to learn how to be a basketball coach for a season and then never go and learn again or keep learning as they go. And so you have to have that continual professional development and support. And I think, from birth up through third grade and beyond, a comprehensive, developmentally appropriate curriculum is a huge support for an educator to make sure that what is a child doing during the day, and how do I ensure that they're fully engaged, and how do I individualize their engagement? So I think the other thing that we're kind of learning about what high quality is that doesn't mean the same thing for a particular child within a classroom. There's lots of disparities that exist within classrooms. And we have to be paying attention to that individualization for each child and what they need.
Right. Thanks, Amanda. Sam, what do families in Nebraska tell you about what they're looking for?
Families in Nebraska say they're looking for quality childcare. But now let me ask all of you who are listening to us, what is quality childcare? And, if we were to actually stop and, get you all to write that down, even in 2 sentences, it would be very interesting, because there'd be so much variability in what that means. And I think that's one of the major tasks that we who are leaders in the field have ahead of us. And that is to help to define what we mean by quality, recognizing that quality for one may not be quality for another because of the vast differences in backgrounds, in history, in language, in ethnicity, and so forth. But still, there are some commonalities, and we need to find that. So we just to help you see some data around this, we found in a recent study that we did just roughly a month or so ago, 500. This was 500 people overweighted by ethnicity and by parents of young children. Nearly all residents in this state, you can generalize, say access to quality, affordable early childhood care and education is very important to families. Now, we've had two axioms as we look at childcare. One is affordability, and the other is accessibility. But we need to have a third one, and that is quality. Accessibility to affordable quality, hard to come by. Well, when we looked at this in our sample, we saw that looking overall at people who responded, so generalized to the state, it's not exactly perfect. Bob might be a little bit anxious by the quality of this sample, but 37% of families said that access to quality, affordable early care and education is very important to families. When we just look at non-white residents, we see 43% of those families think that it is very important. And then when we look at parents of children ages 0 to 5, which includes people of color as well as not, 59% think it's essential. So over time, we start to lose the urgency. And in fact, that's one of the conclusions we draw from this recent survey, that an overwhelming majority agree on the importance of early care and education with high degrees of intensity, but the issue is not a top concern compared to other needs across all groups. And for us, it's a top concern because it is where life begins and where life takes shape. So quality is a big issue. Something that we need to focus on. How do we define it so that one person's quality is not another person's saying, not so good?
Good point. Jacqueline, you want to jump in here on quality?
I think we have to own the fact that we have not defined quality in ways that are helpful. And so parents have a variety of notions of what they think quality is. I mean, and an assumption that if a place has teachers who are certified, if it looks clean, if the hours are fine, then their kids are in good shape. And that may be the case, but not necessarily. I think, my notion of our research challenge is that we really do need to study the components of programs a lot more seriously. We study a program. You're in Head Start, you're in a big program. And so, but that doesn't tell you anything. So if the kids don't do well, then the whole program is just tossed. That's not what we should be looking at. We should be thinking about what's in a program. And so I would want parents to come and say, what are you offering? Are there folks who can deal with parent engagement? Are there nurses? Are there a variety of services? And we need to start being able to give parents much better data on what works for specific groups of kids under what conditions, which is what we're supposed to be doing, and start teasing that out and not making it sound like every preschool program is the same, because they're not. They're just not. If you look at studies of Head Start, I always found those fascinating. Head Start is a funding stream. It is a funding stream, and those monies go directly from the federal government to community organizations that have designed different programs based on their community needs. So it's not one monolithic program. So I think we need to think much more carefully, and this is, I think, something parents should demand. Advocates should be thinking in this way, and certainly for research. What in the world do we mean by quality?
Yeah.
So I'm going to take go ahead, Amanda.
I was just going to say just one example of that we have worked on kind of with the state or had multiple discussions is this idea that the component of quality around curriculum, and that there is no observational measure that is used across, that can be used across providers. They shouldn't all be using the same curriculum, but as a parent, you want to know if what is supposed to be happening in the classroom is actually happening in the day. So I just agree on the research aspect of it and the precision by which we are measuring quality. There is actually a lot more work to do.
Yeah, as somebody who spent a little bit of time focusing on this myself, I think I would also offer, agree with the fact that we have overcomplicated this notion of quality and probably have spent more time on things that are easily countable, like numbers of kids in a room, or whether a teacher has a particular credential, or whether they serve lunch in the place. And again, I know I'm speaking to the choir here with my colleagues on the panel, that we have learned a lot about the components of quality insofar as it's the things that kids are experiencing in that setting that determine the quality of that time that they're spending there for their own learning and development. And I think that's a hard thing to measure, as we all know. That's not an easy thing to measure. It's not an easy thing to necessarily observe. I think one of the things that's really what I take away from some recent studies, which I think is incredibly promising, is that when states move away from these very complicated systems that we're counting every facet of things that we might be able to count about programs, it's like a measure of quality, to your point, Sam, designed by committee, and move toward a more narrow focus, single focus on what kids are experiencing in classrooms, and then begin to align policy and professional development around that. We actually have seen this in Louisiana across 4 years, that when those kinds of metrics for quality, definitions of quality, and incentives for teachers to participate in professional development are in place, quality goes up over the course of 3 or 4 or 5 years. Daphne Basak has documented this quite well. So there's a lot of promising initiatives, I think, that are underway around this, and I could not agree more with my colleagues around the need to pay even more attention to these elements of experience, that kids are receiving in classrooms, and to also point out we actually know some stuff that we can begin to apply tomorrow if we wanted to. We've got I'm going to we're going to do a quick run set of responses to questions that have come in from the audience here. And I know there may be others in the Q&A that I'm going to look at, but there's some of these topics that people have sent in. We've already talked quite a bit about workforce development, state governance kind of issues. But a number of our participants today have asked about the effect of the pandemic on young kids, the K-12 world has talked about this in terms of learning loss. But how is the early care and education sector kind of responding to, from your point of view, the potential impact of the pandemic on the children that they serve? Any observations there? I know this may not be directly related to some of the work that you're doing, but anybody want to jump in there?
Let me just say a word or two. When I think about this for the K-12 world, or the above primary grade world, what I think is needed most is one-to-one tutorial kinds of experiences. You really need to take every kid at where they are. There's some children who although they were given iPads or other kinds of electronic means, never opened them up, never learned how, or they live in a part of town where they can't get connection. All that sort of thing was happening. There are other kids whose parents were home and working with them, and who are doing very, very well. So there needs to be a lot of one-to-one attention. Well, that's something we do in early childhood. We generally don't have large class sizes. We generally are recognizing the need for individualized attention. So I think there's a good chance of that happening. At the same time, the group of us who are on this panel, when we had a moment right before this opened up, started talking about the change in mask policy, where each of us lives. We live in the three of us live in different places. Bob and Amanda, of course, live in the same city, but it's so different and it's so confusing for kids that in itself is a problem, depending on the age and the experience and the kind of support that kids get from their parents. it becomes a problem in and of itself, and it is not over. We may have mask optional in some places, and it may become required before very long. We all know those things. So I think we're right in the middle of it.
Anybody else want to weigh in here on impacts on kids? Jacqueline?
Yeah. We worked with the Meisels Family Foundation and the Hunt Institute to interview a series of folks in early care and education to get their perspectives on what's been going on with kids in the pandemic. And it was very interesting. We had sort of two areas of focus. There were folks who were very, very interested in learning loss, and this notion of having accelerated learning because we've got to catch up because there's been this great learning loss. And then we had a group of people who were not saying that there was no learning loss, but they were much more focused on how do we give children a sense of hope and a sense of security that, yeah, it's been hard. It may still be hard, but we are there with you to get you through this. And I think it's a real challenge for folks in early care and education, because for some children, it's been really difficult. And some children have had lots of experiences. You know, we didn't get through this storm the same way. You know, some had boats, some had yachts, some were drowning, as they say. So how do we help kids wherever they are, as Sam said, to really feel safe and have that sense that the adults around them will help them get through this? And I think that's a big challenge for the adults. But different perspectives. It was very interesting to hear.
Yeah, one of the things that you know, it's interesting that we've been concerned about in a study that we're looking at and thinking about a lot. And I think some of you pointed this out. I think it goes back to your kind of both and characterization of things, Amanda, which is one of the things that we see when we all study follow-up effects of kids spending time in early care and education. I talked at the beginning about the benefits of these. And we talk about the fact that these benefits may fade out when kids enter kindergarten. And one of the things that we've seen in the big study we're doing right now is that some of that fade out actually seems to be more tied to the increase that kids are getting in very academically oriented instruction in very discrete skills in both pre-K and in K. That when pre-K spends more time in enriching kids' language development and focusing on kids learning through puzzles and play with an adult, you know, that's there and engaging them, that learning lasts a little longer, and then the kids pick it up when they get exposed to instruction later on. It's a long windup to a worry that many people have voiced to me, which is when we look at not just early kids, but later on, but particularly young kids, and start worrying about learning loss. And if these programs double down on teaching kids the facts and a lot of very discrete learning to the exclusion of some of these other basic foundational skills in language and self-control and engaging socially with other kids that are really critical then and thereafter, we may actually be exacerbating challenges to their development that in a sense we're doing our best to try to remediate. And so being really careful to ensure, I think, you know, as Sam was pointing out, the importance of a greater amount of stimulation and enrichment for kids is really important. But to make sure that that's tuned to what kids need to learn and how they learn is going to be essential. If we just throw it at them in, you know, large group settings where kids are rehearsing what the teacher is asking them to do, we're going to turn even more of them away, I think. And that's a big concern for us that we've seen in some of our data. Amanda, you want to weigh in here on anything related to COVID impact?
Yeah, just based upon kind of what you said, it is the importance of really thinking about the continuity of early childhood care and education as extending from birth through early elementary school. I actually think we know more, we in some cases know more about quality in a preschool classroom than we do in a kindergarten or first grade classroom. And having done some work in kindergarten classrooms recently, I think you'd be really surprised at the loss of choice, loss of agency, loss of autonomy that some children experience going from a preschool programming into early elementary. And so I think you're right. And I think, Jacqueline, the point you made about people did not weather this storm in the same way. And we did not have a lot of ability to measure the different ways in which different individuals who have different economic means, kind of the types of experiences that people had or had access to have during this time in the pandemic, and then how those kind of, cascade into then what happens afterwards as you either come back into a public school system or stay in a private school system. So I do think kind of the understanding of the mechanisms by which this pandemic will have cascading effects in the future is critical for us both to understand, but also anticipate from what we know from the past and act on now. Before, we don't need to wait for the next pandemic to be like, well, what did we learn from this one in order to do good things for young kids?
No, I think that point is really important, Amanda, because we know that these kind of experiences that happen in widespread traumatic events, like pandemics, like when Hurricane Katrina hit New Orleans, the great economic crash in 2007, 2008. These things show up later in kids' development, and how we as a society kind of can prevent some of those costs to kids and families by many of the kinds of investments I think that we've talked about here on the panel will be critical for this group of kids and many thereafter. I want to just, we're going to need to close, so I'm going to ask Jason to come back and join us. This is a conversation that could go on for a long time. I appreciate the fact that so many folks sent questions in. I think we covered a lot of things, and if there are things that people feel passionately about and would like covered, I will volunteer to answer those questions if you shoot me an email at my UVA email address, pianta@virginia.edu. Let me pitch it to Jason now to close us up.
Thanks, Bob. Fortunately, we are out of time, but really thrilled that we were able to host this Cross Grounds presentation for everybody today. I want to close by thanking Dean Pianta, Jacqueline, Sam, and Amanda for sharing their time and all their expertise and experience with us. And thank all of you, the audience, for joining, submitting questions. If you're interested in watching this again or sharing it with others in your life, the recording will be up soon on the UVA Club's YouTube channel. And I hope everybody has a wonderful rest of the day. And this will conclude our webinar together. Take care, everybody.
Thanks, everybody.